If you clicked on this video, I'm guessing you've had some knee pain. You've iced it, you've stretched your quads, you've taken a week off, you've tried the knee sleeves, and you've done some knee extensions to work around the knee, but the pain keeps coming back. I see this constantly. I've seen regulars at the gym complaining about knee pain. I've seen the exercises they do and the exercises they skip. And in the clinic, I've worked with people who have had knee pain in their workouts. And when I ask about their workouts, I'm not just listening about the exercises they're doing. I'm making a mental note about what they're not doing. And it's often the same gap. I'm Amanda, a doctor of physical therapy and a lifestyle bodybuilder. In my decade as a doctor of physical therapy, I have never once treated anyone with knee pain with just knee exercises. The hip, the glutes, the posterior chain are always involved. Always. Here's why. The knee isn't just this floating structure that's operating on its own. It's connected and part of the entire lower body chain. And when you've had knee pain that's chronic, maybe there for years, that keeps coming back, that's not necessarily caused by a traumatic injury, we don't just look at the knee, we look up the chain because something above it is not working properly. And for most lifters, that something are the glutes. Could you also need some quad work? Yes. But that's never the only answer. And here's something that most people don't realize going into this. The majority of people, men and women, are quad dominant, meaning there's already an imbalance between your anterior and posterior chain. Your quads are most likely stronger than your glutes and hamstrings, and it shows in how you train and in the movements that you do. That's not a personal failure, that's just the default for most people in and out of the gym. And if you're a guy watching this right now and about to click out of this video, don't. You don't get to brush this off. I've treated many guys over the years with knee pain. Posterior chain work, glute work was always a part of it and always helped. Don't ego lift your way around working your posterior chain. So in this video, I'm going to walk you through 3 things. How your glutes may be contributing to your knee pain, what that looks like in your training, and what you can do about it. I'll link the related videos I've made on some of the exercises that I'll talk about here in the description below, so you can watch those after this video if you need. Let's get into it. First up, let's start with the knee. That's where the pain is, right? So where is that pain coming from? The knee is a hinge joint. Its entire function is flexing and extending your knee. It doesn't do lateral movements or rotation. Those are controlled by your hips. So if you're doing squats and you see your knees caving in, it's not your knee's fault. That's coming from further up the chain, from your glutes. So if you're treating your knee with icing, bracing, resting for a week or more, stretching your quads, or just doing knee extensions, hoping to strengthen your knee, it only treats the site of the pain, not necessarily what's contributing or causing it. If your knees are caving, there's no amount of flexion and extension exercises that you're going to be able to do to fix that, because it's not coming from your knee, it's coming from your hips. If you're not changing the mechanics or the support system to the knee, that pain will keep coming back. So instead of just treating the symptom, we want to treat the core issues. So you might be wondering, the glutes don't attach to the knee, so why would they be causing pain? And that leads us to the next point of what your glutes actually do for your knee. So the part of your glutes called the gluteus medius is responsible for abduction, kicking out to the side, and controlling your femur from rotating internally and adducting under load. If your gluteus medius is weak or it's not activating well, which is very common for a lot of people, you'll notice your knees caving in on movements like your squats and lunges. And that often contributes to patellofemoral knee pain, IT band syndrome, and anterior knee pain in a lot of lifters. Your gluteus maximus, on the other hand, is the much bigger muscle that's responsible for hip extension. Now, when you're doing big compound movements like squats, lunges, etc., you're not isolating your quads versus your glutes. Both sides are working, but your body will automatically choose the path of least resistance. It'll go with the stronger muscle. And for the majority of people, your quads are going to be doing more of the work. If you don't intentionally train your glutes will just go along for the ride, maybe assist as much as they can, but they're not really going to be contributing as much to those movements. Your quads will overcompensate because they are the stronger muscle and they'll do what they need to do, but that causes increased stress to the knee joint. And I've seen this time and time again. When my clients start training their posterior chain, they'll notice strength increases in terms of their squats deadlifts, and other lifts because they're getting better activation through their posterior chain to help with those movements. And you're not relying solely on your quads as much anymore. And real quick, if you're trying to build a program that actually accounts for how your body loads and addresses the imbalances that need to be fixed, that's exactly the work I do inside Strong Without Breaking, my one-on-one coaching program. Link is in the description. And if you found this video helpful so far, give it a like and subscribe to the channel if you haven't already. It tells YouTube to show this video to more lifters like you so they can address their knee pain too. Now, let's keep going. When someone comes to me with knee pain from their workouts, I usually ask them which exercises are painful for them. Most of the time, it's exercises that are loaded, compressing the knee joint in some way. Squats, lunges, leg press, etc. And pain tends to increase as they load up the machine or the exercise more. When you're doing your next leg day, I want you to ask yourself these questions. Start with which exercises specifically are causing pain. Secondly, at which point of those movements does the knee hurt? For example, if your knees were hurting with a squat, which position is the most painful for you? Is it standing at the top of the squat? Is it as you're lowering down into the squat? Is it in the hole of the squat? That gives me more information about the kind of compression you're feeling in your knees. Also, where are your knees during those movements? Are your knees tracking in, like we just discussed earlier? Are they still staying over your feet or your ankles? Everyone's knee pain is different, and as I always say, there is no one-size-fits-all cookie-cutter program for everyone. This is why I ask these questions when I work with my clients. The types of exercises that are painful for you are information as to what the types of loads and movements are that your knees are not able to handle right now. Now, if your knee pain is with a single leg movement, like lunges or a single leg press, then again, we look at where your knees are tracking. Are your knees caving in when you're doing the exercise? Is it harder to do this exercise on one leg versus the other? Are you having more trouble balancing on one leg versus the other? Is one leg more dominant? Have you had any previous injuries on one leg versus the other? All of these contribute to how your body adapts and compensates for any kind of weaknesses or imbalances you may have. Your body is smart. It'll adapt to make sure you can do the movement, but the adaptation isn't necessarily an optimal one. That adaptation or compensation can eventually lead to pain if you don't know to address it. And the last question, what types of glute exercises are you doing on your leg days? Are you doing any at all? And if you are, what types of loads are you doing? What does your form look like? What do your mechanics look like? Are you progressively overloading? All of these can contribute because that'll tell me a lot of information about how much glute training you're doing compared to these heavier compound movements where your quads are compensating, and whether there's things that we need to tweak and adjust so that your body's now training to help protect and support your knees. Okay, so now that you know you need to be doing some glute work, what types of exercises can you do? Now, for your gluteus medius, again, that muscle is responsible for abduction and controlling your knees from caving in. So you can do banded clamshells, lateral band walks, the seated abduction machine, which is very common in the gyms, but leaning backwards more. You could do glute med kickbacks, glute med hip thrusts. There's so many different exercises you can do. That could be an entire video in itself. And then for glute max, you can be training those using your hip thrusts, glute focused squats, reverse lunges, glute focused Bulgarian split squats, RDLs, etc. And you'll notice a lot of these are compound movements that you might already be doing, but the adjustment is intentionally focusing on your glute activation. And that means adjusting your foot and knee position. So instead of an ass to grass squat, for example, which will be activating your legs more, you'd be doing a glute focused squat or box squat instead. And if you want a run through about the difference between an ass to grass squat and an actual glute focused squat, I'll post that video up here and in the link description below. Adding in glute work doesn't mean you need to stop squatting. It doesn't mean you need to stop doing the exercises that are causing some pain. The key is working on your foundation and your form with the exercises that are causing you pain. So let's say if your pain is with squats, can you shift your weight back so you're driving through your heels more? Can you make it more of a glute focused squat so that your knees aren't caving in? Drive your knees out. making sure your hips are sitting back like you're sitting into a chair. If you've reduced the weight and you're still noticing your knees caving in and you're not sure how to keep them from doing that, try adding a resistance band around your knees so that you have something physically around your knees that you need to push out and focus on that driving out movement to train your gluteus medius to activate better. Once you get your form down, once you get your foundation down, then you start loading the exercise back up gradually, making sure you're maintaining that proper form. And you'll notice a big difference in how much your knees can handle at that point, because again, now you have your posterior chain actually help drive the movement. You don't need to change your training entirely. You don't need to revamp your entire leg days at the gym. Swapping out some exercises, working on building that posterior chain activation, building strength in your glutes will go a long way. When you're doing these heavier compound movements, you're training the anterior and posterior chain. It's not one versus the other. But instead of continuing to do the same form that you're used to, where your quads are overcompensating and continuing to increase the pressure to your knees, add in some sets where you're actually focusing on your glute and posterior chain activation to balance things out. So treat your knee pain by training the muscles above it. It'll take you a lot farther in your training and your knees will thank you. And if you want my help in addressing those imbalances and revamping your leg day program so that you're addressing your anterior and posterior chain to get you back to lifting confidently, that's what Strong Without Breaking is for, and links in the description if you're interested. And now that you understand the mechanics behind this, watch this video next. The V-squat machine is one of the most common ones that cause knee pain in the gym. And now that you watch this video, this one will make a lot more sense. So that's the full picture on how your glutes help protect your knees, the mechanics behind it, what it looks like in your training, and how to address it. So if you found this video helpful, give it a like, subscribe to the channel if you haven't already for more Dr. Physical Therapy workout and exercise breakdowns, and I will see you in the next video. Thanks for watching.